I'm Dominique Lavigny, your Bakersfield neighborhood reporter. The Kern River is just one of the stops the Clinica Sierra Vista street medicine team makes to help serve the homeless population in Bakersfield. And now additional state funding will support their work and expand their services. On the banks of the Kern River.
Good morning, Matthew, you down there?
Just after the crack of dawn. Dr. Matthew Baer with the Clinica Sierra Vista street medicine team keeps an eye out for unhoused people.
How you been?
Each person Baer meets needs something different.
Besides the hygiene and all that stuff, is there anything else going on? Anything you need?
No.
He works with his team to pack hygiene kits, lunches, and prescribe medications as needed.
Yeah, no, that's what I'm saying. If you didn't have your meds, that would make it so much worse.
But sometimes Baer says they return to find their patients aren't there anymore.
Unfortunately, we've had more people than we'd like lost to overdose, and so some weeks we've shown up and then we find out that one of our patients is no longer here because, you know, they succumbed to an overdose.
That's becoming increasingly more common as the Kern County Coroner's Office reports a steady rise in fentanyl-related overdose deaths since 2017.
And we have like a really close relationship with these patients, so it really is like losing a friend. Good morning, guys. How are you?
So Baer says they try to keep their patients prepared.
You guys have Narcan?
On Tuesday, the Kern County Board of Supervisors approved a $1 million grant to Clinica Sierra Vista through the Fentanyl Misuse and Overdose Prevention Task Force started by Assemblywoman Jasmeet Baines to prevent more overdoses from happening in Kern County.
There is nothing funny about the fact that people are dying from fentanyl daily.
The state granted $10.5 million to the task force, which Baines split in half to distribute to local law enforcement and medical care providers.
You have people on one side and the other side saying, all we got to do is lock everyone up. We got to increase treatment. It's both.
Baer says the funding will support their current street medicine efforts and build their addiction medicine fellowship program to support fellows like Milagros Becerra.
There is a huge need here in Bakersfield, and there are not that many providers.
According to the National Institutes of Health, less than 2,500 physicians in the nation specialize in addiction medicine. Baer says the growth of the program will provide more access to those specialists in the field here locally.
So when you start looking into what's going on, you provide them help, they can start turning their life around, they can get their life back. And that to me is amazing, that you can give their life back to somebody.
And as the street medicine team heads to their next stop to continue serving the unhoused in Bakersfield, they say the expansion of resources and services through the grant money will help combat the fentanyl overdose crisis in Kern County. And for a list of the other organizations receiving additional state funding through the Fentanyl Misuse and Overdose Prevention Task Force, you can visit our website, turn23.com. For 23 ABC News, I'm Dominique Lavigny, your Bakersfield neighborhood reporter.